While it is still extremely rare for children to become seriously ill or die from COVID-19, hospitals primarily based in the southern U.S. are reporting a sharp uptick in the number of children they are seeing admitted, with some hitting new pandemic records, as the Delta variant continues to drive a concerning surge in cases and hospitalizations nationwide. It's unclear whether the trend is occurring nationwide because there is no regularly updated, comprehensive data on child COVID-19 cases available. The last report from the Centers for Disease Control and Prevention, CDC, in early June, found hospitalization rates among children peaked at 2.1 per 100,000 in January 2021. The American Academy of Pediatrics, AAP, releases a weekly report on child cases and hospitalizations, but not all states regularly submit data. Its most recent report on July 22 calculated children made up between 1.3% and 3.6% of total reported hospitalizations, 0.1% and 1.9% of all child COVID-19 cases resulted in hospitalization. Overall, the risk of death and hospitalization among children who contract COVID-19 remains extremely low. Just over 520 children have died from COVID-19 since the start of the pandemic, 0.08% of the US's 612,000 total deaths, and only around 0.01% recorded cases result in death. However, the CDC highlights it is still possible for children to suffer from severe disease as it occurs in all age groups. Experts have floated numerous explanations for why child hospitalizations appear to be on the rise. Many cite data which shows younger people are making up a larger proportion of new cases, which are predominantly the more infectious Delta variant. For example, Florida earlier this month saw an 87% increase in coronavirus cases in children under 12 years old. In Louisiana, school-aged children had the third highest number of coronavirus infections when the data was last reported by the State Department of Health. Children below 12 are also unable to get the coronavirus vaccine. Meanwhile, inoculations are severely lagging among teenagers and young adults. Dr. Rick Barr, the chief clinical officer at Arkansas Children's Hospital, told CNN the parents of hospitalized children are shocked because the messaging out there has been that kids don't really get sick with COVID, and we didn't see serious illnesses, except for rare instances, with the previous variant. Seeing what is happening in his hospitals has led many parents to understand the value of vaccines, Barr said. In fact, they're encouraging other parents to get their kids vaccinated. How the uptick in cases and hospitalizations in some parts of the U.S. will impact the upcoming school year. The CDC has recommended everyone, students, teachers and staff, in K-12 schools wear masks while indoors to curb the spread of the virus. These concerns may be calmed when a coronavirus vaccine is approved for use for children under 12, but experts have said this may not happen until winter.